Attitudes are changing on the healing potential of pot. 25 states plus Washington, D.C. have enacted laws to legalize medical marijuana. First on CBS This Morning, a new survey from Prevention magazine reveals 75% of Americans think it should be legal. 35% would be extremely or very likely to use medical pot if advised by a doctor. Our Dr. Holly Phillips is here. Holly, good morning.
Good morning, Nora.
So now that it's legal in half of the United States, what more can be done?
Well, right now, what we can say...
Or what is being prescribed for, I should say. Yeah.
Sure. Well, it's being prescribed primarily for pain, and that could be pain from headaches, cancer pain. It's prescribed in a lot of other settings, too, for people who have nausea from chemotherapy. It's being studied for post-traumatic stress disorder in veterans. It's being used for muscle spasms, for people who have multiple sclerosis and Alzheimer's disease to improve their appetite. It really is being prescribed for a wide variety of uses right now.
And how effective is it?
Well, so that's the question, Gail. We do have some evidence that it works. We need more. Right now, we've got some small studies, strong international data, patient testimonials. What we're waiting for is a big gold standard randomized controls trial to show how it works and why. But what's interesting is part of the reason we don't have that has to do with the drug scheduling. Since 1970, marijuana has been a Schedule I drug. There's 5 schedules in the DEA. Schedule I is for the most dangerous drugs, the ones with the highest potential for abuse and no medical benefit. That makes it hard to study. Researchers have to get approval from 3 different government agencies at least, and the red tape is so daunting that studies don't get off the ground.
Specifically to abuse, I've talked to NFL players for years and years about this, and they say to a man, they would much rather use something like medical marijuana than the Percocet and the Vicodin that they've seen a previous generation of players use and abuse, and they've seen what opioid addiction can do. They've seen it for years.
Absolutely. I mean, Josh, that's one of the most critical points. And I think that, when we look at the prevention survey that showed a much greater acceptance of the use of medical marijuana, that's what's underlying it. For instance, here's what we know. Someone dies of a prescription overdose every 19 minutes. The opioid painkillers kill thousands of people a year. Lethal overdoses with marijuana really aren't a concern. They've been documented rarely, if ever. So while we still need more evidence to show what medical marijuana can do, whether it's effective, we definitely know when it comes to treating pain, it's safer than the opioid drugs, Percocet, Vicodin,
and you're unlikely to
OxyContin.
die from a marijuana overdose, as you just pointed out.
Much less likely.
All right. Thank you, Dr. Holly Phillips.